point. Dr. Wenstrup, take it away.
Thank you, Mr. Kelly. I appreciate you obliging me and giving me more time, as I'll use my time when it comes about, too. And before I get started, without objection, I'd like to enter a statement for the record on behalf of my friend, colleague, and fellow co-chair of the GOP Doctors Caucus, Dr. Murphy. He's away. He's going to be undergoing surgery. I want you all to keep him in your prayers. And without objection, I'd like to submit his statement for the record.
So ordered.
So obviously, everything you've said is spot on. We've covered on all the points. But our country's facing a critical shortage, and access to quality care is definitely a problem. One thing I do want to say is that I hope that we don't, as the medical professionals, reduce the level of expectations in our education and training, as it'll make it even more difficult to defend our value. We've got to do that. You mentioned board certification. It's important in every one of our specialties because it represents ascertaining the highest level of quality care that you can provide. And I get that. You know, it's so hard to fathom what has happened to medicine because providers are the product. We are the product and are the key to a healthy nation to begin with. And we need a strong, uninterrupted doctor-patient relationship to exist. When I first started in practice, I set up my own practice. I had 2 employees, and if someone was sick, my mom came in. You like that, don't you, Dr. Colson? And it was wonderful. It was wonderful. And as time changed, I joined a large orthopedic group, but I still practiced as an independent physician, felt it, you know, as a type of practice where Christmas time, people are bringing you gifts, you've developed relationships, and I think that's the key to a successful outcome. One of the reasons I ran for Congress is I looked at Washington and I said, we have people making healthcare decisions that have never seen a patient, have no idea what it's like being out in the trenches. And the profession has changed a lot since I started that practice, which I valued. But it was no problem when I went to a larger group because we were all of the same ilk. We were independent. We were practicing. Our reputation mattered in the community. That's what mattered. Not what Washington thought. I've always felt it really didn't matter to me. Yeah, you know, if you want us to do this, submit this and that, which obviously, as you know, and if everyone's commented, it got worse and worse and worse and more burdensome. But I remember starting out in practice, and every day from Washington, I was hearing about greedy doctors, greedy doctors. This is 1980s. And I thought, I'm $185,000 in debt. That's cheap today. That's cheap today, and I worked during school to keep it down. I'm not greedy. And I figured I'll make a good living as long as I do a good job and take care of people. That's all it comes down to. I'm against fraud. We want to catch people that make fraud and everything else. But other than that, get out of our way. Let us take care of people. We get on calls for prior authorization. And I'm talking to somebody who's not in my specialty, telling me what I can and can't do. I ask them for their license and how the patient can make an appointment for them. Because if they're going to take over the care, they should take over the liability. And I'm just sick of it. They take no liability, but they determine the outcome of the patient. They delay the treatment of the patient, all of these things. We've got to take control. And we got to start telling Washington, as providers and as members of Congress, enough is enough. My time has expired here, but I'm just getting warmed up. You know, one of the things I want to continue with what I'm saying, when I said I didn't care what Washington thought, I didn't want them to have to worry about what I was doing either, you know, at the same time. I cared about what the patient's results were, what they thought, what my referring doctor thought, what my hospital community thought, what my fellows around me, my society thought, all those types of things. Because when you do that, you're going to be fine. But if you're doing something out of the extraordinary or something inappropriate, Dr. J, you kind of touched on that. I understand that. You know, let's have some oversight here and there. Our society should have oversight over how people practice. All those things are important. But I remember in my first term here with the Doctors Caucus, we're meeting with CMS, and they said to us, all the things we're starting to implement are really starting to work. I said, for who? For who? I said, you've taken the joy out of taking care of people. You have made it such a burden to actually put your hands on someone's shoulder and take care of them and tell them you're going to be there for them, because you spent more of your time trying to appease them, who never sees the patient. You know, it's going forward. Okay, what are we doing forward? You know, as a GOP Doctors Caucus, we talk about let's focus on making America the healthiest nation on the planet. What are we doing? Is everything we're doing leading to better health for all America? And how do we incentivize prevention? And how do we understand here in Washington the return on investment when we actually have a cure for something, and the cost of it pales in comparison to treating someone for 25 years? Those are the types of things we need to work on here and move forward as a nation so that we can do more for patients, because there is a greater value to the healthy human being. And even those with chronic illnesses, if we can keep them healthy, guess what? They can go to work. They can do things and pay taxes, which is more money we can get our grubby little hands on up here. And that's, you know, but the value of the healthy human being is never really considered. We have to keep promoting this. I do want to spend time talking about something that I know will be near and dear to Dr. Golson. Xavier University in Cincinnati, Ohio is starting a new DO school. Why are they starting DO? Because DOs tend to gravitate more towards primary care. And look, you know, the practice that I have as a podiatric surgeon, you know, we're doing vascular, we're doing orthopedics, we're doing dermatology, we're doing a little bit of everything, sports medicine. We do a lot of prevention. We do a lot of prevention, try to prevent ulcerations, limb salvage, those types of things. So this is near and dear to my heart that we focus on preventive care and incentivize it. You know, the doctor that does the CABG, the open heart surgery, that's great. You save a life. You should be rewarded for that. That's tremendous. But the primary care doctor that works with the patient that prevents them from ever needing that CABG, you really don't get rewarded for that. We need to focus on those types of things. That'll be better for us as a nation. So Xavier's starting the DO school because they tend to focus more towards primary care, which we need in Southern Ohio tremendously. At the end of the Trump administration, we did pass for 1,000 new residencies with a large focus should be going to rural. So I'm trying to coordinate residency programs in our rural areas because, as you said, people stay. These are some of the solutions, though. This is the things we have to focus on. But I want to go back to the problem, and I really want my colleagues to focus on this. We need to take control. We passed the No Surprises Act in a bipartisan fashion to take anxiety away from patients, to worry about, if they don't have to worry about their bill, it'll be taken care of between the insurance provider and the doctor. We did it in a way that we hoped would be fair to everyone, and where doctors would want to be in network and insurance companies would want you in network. And HHS went and changed the bill to exactly what we said we didn't want. These are problems we have here, but we need your voice to keep talking about these things so that we can make the changes. And so I don't really have a question, but I want to go back to that with Dr. Golson and get your comments on that, because I hope this is going to be a successful thing. And you have somewhat mimicked that with, I think, sounds like what you did at the state level by helping to get the residencies underway. Can you comment on that a little more?
On the work that the OMPW has done?
Yes.
Yes, so we started that about 11 years ago with the idea that we needed to increase physicians in rural areas. Specifically, we needed to increase well-trained family medicine physicians in rural areas, because we felt like that family physicians could take care of maternity needs, they could take care of pediatric needs, they could take care of preventative visits. It seemed like the best solution to help with our lack of medical care in rural areas. But we too recently started a DO school in Mississippi. It's relatively young. I think they've graduated their second or third class. And it's been good to see their commitment to primary care in the state. But it's a pipeline. It doesn't happen overnight. One of the things we also did is we started the Rural Medical Scholarship Program. So we encouraged our medical students at both the MD University and the DO University to choose to go into primary care, and so they were able to graduate medical school with no debt.
Thank you. My time has expired, but thank you very much.